Quick disclaimer. Information in this podcast is for general informational purposes only and is not intended to be treated as medical advice. Always consult with your healthcare team before making changes to your diet, lifestyle, supplementation, or medication.
What we're talking about here is an inflammation that can affect all your body's cells. Long-term inflammation, ongoing inflammation, often referred to as chronic inflammation, cellular inflammation, or systemic inflammation.
Welcome to Type 2 Diabetes Talk, the place where we chat about what really works to treat type 2 diabetes and prediabetes naturally with nutrition and lifestyle. If you're looking to optimize blood sugar and A1C, lose weight, reduce medications, and improve your overall health, this is the place to be. Now, here's your host, Type 2 Diabetes Nutrition Specialist, Dr. Jetta.
Hello there, welcome to episode 41, where the topic of the day is all about inflammation. I developed an interest in inflammation about 13 or 14 years ago, and as a result, I explored inflammation extensively during my Masters in Nutrition. It's interesting because when people think of inflammation, they often think about conditions like arthritis, which certainly is an inflammatory condition. Or if you get a cut on your hand, it's normal for the cut to become red and inflamed. But inflammation goes much deeper than that. Inflammation plays an intricate role in the development of many health conditions, including in the development and progression of type 2 diabetes and prediabetes. Inflammation is involved in type 2 diabetes and prediabetes as both a cause and a consequence, meaning that initially inflammation may trigger the development of diabetes, but also once you're diagnosed with diabetes, ongoing inflammation in the body's cells can contribute to various symptoms or complications. So today we're going to dive deep into understanding what inflammation really is, how it plays a role in the development and progression of type 2 diabetes and prediabetes, and what we can do to manage it effectively. In particular, we'll explore the impact of diet and nutrition on inflammatory processes and practical steps to reduce chronic inflammation through nutritional strategies. After the episode, if you want to find more information, you can head to our website and find any notes alongside episode 41, or for members, head to the members library to find the additional resources. Okay, ready to dive in? Let's get started. So first you may ask, what is inflammation exactly? And that's a great place for us to start. Think of inflammation as your body's security system. It tells your body something isn't right. As we said earlier, if you get a cut on your hand, it's normal for the cut to become red and inflamed. This is your body's way of triggering our immune system to help you heal. Inflammation is a natural response from your body, sending in special helpers to support healing. This is acute inflammation, and once the wound is healed, the inflammation stops. Similarly, if we get a virus, the body's immune system is stimulated to release inflammatory helpers. Then once we're better, the inflammation subsides. Then there's another kind of inflammation that can occur on a cellular level, meaning you don't see it, but it's affecting all your body's cells. Long-term inflammation, ongoing inflammation, often referred to as chronic inflammation, cellular inflammation, or systemic inflammation, or a low-grade chronic systemic inflammation. And this type of inflammation is problematic because your body becomes a bit confused. Normally, inflammation means something is wrong, but chronic inflammation is triggered by ongoing stimulus. The immune helper cells try to do their job of healing, but ongoing stimulus results in recruitment of more cells, increased inflammation, and even changes to cells. You see, inflammation puts high stress on the cells and tissues within the body, and it causes them to start to change over time and can result in things like high blood pressure, high cholesterol, increased weight gain, aches and pains. And the negative part about it too is that it can become a bit of a vicious cycle. These symptoms may be a result of inflammation, but they also cause more inflammation because your body recognises something is wrong but just doesn't quite know what to do about it. The bottom line is that inflammation is a necessary physical response, but left unchecked, inflammation can wreak havoc on our health. We know that chronic systemic inflammation is a contributor to many health conditions: diabetes, weight gain, heart disease, depression, digestive issues, and really the list goes on. As I said earlier, inflammation is involved in type 2 diabetes and prediabetes as both a cause and a consequence, meaning that initially inflammation may trigger the development of diabetes, but also once diabetes is diagnosed, ongoing inflammation in the body's cells may contribute to various symptoms or complications. Let's take insulin resistance as an example. We know insulin resistance is an underlying cause, an issue in both prediabetes and type 2 diabetes. We talked about this in episode 26. While there are potentially multiple reasons why insulin resistance develops, a lot of the evidence suggests it all begins with diet-induced inflammation. Nutrient sensors in the body cause inflammation in the central control organ of the brain, the hypothalamus, which causes a cascade effect through our entire body and the body's hormones and metabolism. Insulin resistance can then trigger a heightened inflammatory response as the body's tissues become stressed by the inability to effectively use glucose for energy. Let's look at a few more examples to demonstrate how inflammation may influence our health. As weight increases, fat cells themselves release inflammatory molecules, increasing inflammation throughout the body. It is possible for these immune cells to invade the pancreas, where they can produce more inflammatory molecules, and this could potentially lead to destruction of the pancreatic beta cells. This low-grade chronic systemic inflammation can increase risk of complications, as I've mentioned several times. And chronic high blood glucose levels leads to the formation of advanced glycation end products, otherwise known as AGEs. And AGEs can bind to their receptors on various cells, promoting inflammation and oxidative stress. Oxidative stress, which you've probably heard of before, arises from an imbalance between the production of reactive oxygen species and the body's antioxidant defences. And high glucose levels and insulin resistance can increase oxidative stress production. When other related conditions develop, such as high cholesterol or blood pressure, these can also contribute to the inflammatory responses of the body, increased inflammation. And there's also other potential factors, and I know that's all quite technical, but essentially inflammation, a chronic systemic inflammation occurring in the body's cells, is at the bottom of it all, and it can happen to us all. And there are some things within our power to change this, and some things outside of our power. But here on Type 2 Diabetes Talk, we focus a lot on the power of nutrition. So let's look closer at diet and nutrition and how this might spark inflammation and help heal it as well.
Get proven, practical support to lower blood sugar, weight, and medication. Check out Dr. Jetta's programs and services at type2diabetestalk.com/programs.
In the modern Western diet, there are many food products that could potentially be pro-inflammatory foods, foods that increase inflammation. Think about our modern Western diet. It's filled with food products that are highly processed, filled with excessive amounts of refined sugar, grains, additives and preservatives, all of which are unnatural to the body and this stimulates a negative response from the immune system. It's also because a lot of food products are overconsumed in much larger portions than is healthy and on too frequent a basis. Foods that were meant to be eaten in moderation, meaning occasionally, are now consumed every day, 3 times a day or perhaps even more. And unfortunately, the body does not respond well to this. Yes, the body is intelligent enough to know that these foods aren't right for our bodies. So let's briefly cover some pro-inflammatory foods that increase inflammation. Number 1 is sugar. Sugar comes in many different forms, but the main thing about sugar is it provides no nutritional value other than energy. While sugar itself may be okay in moderation, sugar is now an ingredient in so many packaged foods these days, from biscuits, cakes, sweets, cereals, pies, crackers, ready-made meals, ice creams, to packet foods, tinned foods, bottled and jarred foods. Yes, I rushed through those because there are so many of them, but the key point is we are over-consuming sugar in copious amounts. In the 1700s, the average person ate around 4 pounds or 2 kilos of sugar per year. Now the average person might consume 130 pounds or 60 kilos per year. So the average person a century ago only consumed very small amounts of sugar in a mostly unprocessed food diet. And we now consume sugar excessively in a diet that also contains lots of other food processing. And this is one key thing that can drive inflammation. Refined and processed grains are another example. Highly refined white flour, for example, is used in the majority of products that often contain little fibre and have, again, high sugar amounts and a high glycemic index that essentially makes them equally as bad as sugar. They are empty of nutrients and rapidly increase inflammation in the body. Common cooking oils are highly inflammatory. Think safflower oil, soy, corn, cottonseed, peanut, rice bran, and vegetable oils, and along with all types of margarine. These oils are very high in omega-6 fatty acids, which promotes inflammation through the production of pro-inflammatory molecules. And too much omega-6 also prevents the powerful omega-3 anti-inflammatory fatty acids from converting, as both types of fatty acids compete for the same enzymes. And the issue here again is these common oils are consumed far too much because they are cheaper oils to include in processed food products. Food additives and preservatives. The impact and effect of many of them on our health is still largely unknown. Why is this? Because while food additives are FDA approved for safe human consumption, these are usually tested in isolation of other additives, and we have very little data on how additives and preservatives react with one another to affect the body. Research I've looked at this week, in fact, highlighted the potentially detrimental effects of common food additives, emulsifiers, in terms of risk of developing type 2 diabetes. And these were emulsifiers found in very common foods like breads, cakes, biscuits, ice cream, chocolate bars, margarines, and many other processed foods. And one plausible explanation for this was due to the impact of emulsifiers on gut bacteria, which leads to a chronic low-grade intestinal inflammation. The consequences of this obviously travel to the rest of our body. Another question people often ask is whether carbohydrates cause inflammation. Both carbs and inflammation are intimately linked to type 2 diabetes and prediabetes and your overall health. For example, we know carbohydrates are the nutrient that most impact blood sugar levels. Hence, if you want to lower blood sugar, lowering carbohydrate intake and choosing the right types of carbs can be very helpful. We also know uncontrolled diabetes leads to higher levels of inflammation. High blood sugar levels can increase inflammation and cause elevated levels of inflammatory markers throughout the body. And scientists propose this is due to an increased production of reactive oxygen species, those free radicals and advanced glycation end products, those AGEs I spoke about earlier. So yes, consuming too many carbohydrates can influence blood sugar, insulin resistance, gut bacteria, and metabolism in ways that can lead to increased inflammation. So if our diet and the foods we eat can get us into this whole messy situation with inflammation, can it help us get out of it? The answer is, of course, yes. Before we dig into that, let's hear a testimonial from one of our members.
Carmen said, "My health has improved a great deal. I used to have difficulties walking in the mornings due to joint inflammation. I have lost 20 pounds, and I am now inflammation and pain-free in the mornings. My A1C has come down from 6.5 to 5. I have recommended the site to many friends and colleagues. They are amazed at the fact that I have lost the weight without complaining about being hungry and tired of dieting. These meals have become my new way of life."
As I shared at the beginning of the episode, I developed a very keen interest in inflammation around 13 or 14 years ago, exploring it during my Masters in Nutrition. It was around that time I discovered Dr. James Hebbett's early research on the Dietary Inflammatory Index in 2009, which was later redeveloped and has now been used to assess many different diets. When it comes to an anti-inflammatory diet, there is no one universal definition of an anti-inflammatory diet. But one key thing researchers have learned from applying the Dietary Inflammatory Index to lots of studies in more than 30 countries around the globe, the one thing that is crystal clear is an anti-inflammatory diet is a whole foods-based diet, a diet that contains real foods, nutrient-dense foods. Think home-cooked foods in their closest form to nature, foods that provide the nutritional support our body needs to function optimally. In contrast, the types of foods we covered earlier, sugar, refined flours, vegetable oils, and processed foods that make up our modern Western diet are energy-dense but nutrient-poor, and these increase inflammation. So the type of foods to eat to beat inflammation are the same as those we covered in episode 6, to eat to treat diabetes. With our meal plans and nutrition recommendations, our members are tackling multiple angles of their metabolism and health. So you can go back and listen to episode 6, and as a bonus, you can also grab a free copy of our recommended food list. Just head to type2diabetestalk.com/food list. And the food list has got a list of key foods to eat, minimise or avoid, and is a great way to get started. For our members, head to the members site to find the anti-inflammatory index of foods alongside episode 41 or in the downloadable guides. Right now though, let's cover some key things you can do to reduce inflammation, and we're going to focus on nutrition here. Number 1, which we've already covered, is to avoid sugar and refined carbohydrates, the highly refined and processed grains. The number 1 dietary factor that drives inflammation sky high is the consumption of sugar, refined grains, and those high glycemic load processed foods. So you really want to cut down extensively on those, minimise those in your eating plan. In addition, one of the negatives of packaged and processed foods and baked goods are they often contain partially hydrogenated vegetable oils, and during this process small amounts of trans fats are produced, and even trace amounts of trans fats can have negative health outcomes, including increased inflammation. So again, the key here overall is to minimise processed foods. Choose whole food sources and avoid packaged and processed foods as much as possible. And always be reading the food labels, the ingredients lists, to ensure that the items that you're choosing contain quality ingredients and not an ingredient list that is as long as your arm with so many ingredients you just don't recognise. That is not a good product choice. Better yet, load your plate with foods that don't require a packet at all. Load your plate with vegetables and fruits, and for the widest variety of vitamins, minerals, fibre, and phytonutrients, substances needed for the body to function at its best. Fresh fruits are great, and in particular, lots of vegetables are the answer. Non-starchy veggies are also the best source of carbohydrates to consume, and there are an abundance of vegetables to choose from in a variety of colours, and you can eat them in large volumes at every single meal. Consume protein with every meal. Fresh, unprocessed meat, fish, seafood, or plant-based proteins are your best choices. Include fresh and dried herbs and spices. Include neutral and beneficial oil, like olive oil, the benefits of which we covered extensively in episode 14, and other monounsaturated fat-rich foods like avocado, hazelnuts, macadamia nuts, and almonds. Take it one step further and try to balance the omega-6-3 fat ratio. And in terms of fats, most people have higher levels of omega-6 fatty acids compared to omega-3s. And as we established earlier, it's because many processed foods contain low-quality vegetable oils. And since omega-6 and omega-3 fats compete for that same conversion enzyme, and omega-6 is considered pro-inflammatory, well, if you're consuming, or over-consuming, I should say, the sixes, the result is often increased inflammation. So by including more omega-3 rich foods, such as fatty fish like your salmon, tuna and sardines, along with nuts and seeds like chia seeds, walnuts and hemp seeds, you can balance out that omega-6 to 3 fat ratio a bit and help decrease inflammatory molecules in the body. Dietary fibre is anti-inflammatory as it feeds good gut bacteria, leading to the production of short-chain fatty acids like butyrate, and these short-chain fatty acids have been shown to reduce inflammation in the gut and throughout the body. So again, focusing on all of those vegetables and the nuts and seeds is going to dramatically increase your consumption of dietary fibre and help keep inflammation at bay. Speaking of gut bacteria, maintaining a healthy gut microbiome is crucial for reducing inflammation. An imbalance in gut bacteria, known as dysbiosis, can lead to increased intestinal permeability, allowing harmful substances to enter the bloodstream and trigger this systemic inflammation that we've been talking about today. So we want to encourage the good guys in our gut as much as possible, which we do by eating lots of vegetables and fibre from nuts and seeds and small portions of beans and legumes, and also by decreasing all the pro-inflammatory foods we've talked about today. Then there's probiotics, live microorganisms we can get from supplements or from probiotic foods, for instance, from fermented foods like yogurt, kefir, sauerkraut, and kimchi. All of these introduce beneficial bacteria to your gut, and also prebiotics, which are non-digestible food components that selectively stimulate the growth and activity of beneficial gut bacteria. So prebiotics are found in foods like garlic, onions, and asparagus. And again, these feed the good bacteria. So all of that is a really great and powerful thing to reduce inflammation. Turmeric is a potent anti-inflammatory agent due to the compound curcumin that it contains. Tea, especially green tea, is very anti-inflammatory because it's high in special polyphenols. So here's a tip. Adding turmeric and lemon juice to tea can enhance its anti-inflammatory properties. Lemon juice provides vitamin C, which also has antioxidant and anti-inflammatory effects, and can enhance the absorption of curcumin from turmeric. So you can have a green tea with some turmeric and lemon juice to help decrease inflammation. In fact, there are a wide range of plant-based phytochemicals that provide potent anti-inflammatory power. Flavonoids, carotenoids, polyphenols, and other compounds found in vegetables, fruits, tea, nuts, seeds, olive oil, herbs, and spices. These are all beneficial for our health and reducing inflammation. So be sure you choose a wide variety of different sources of foods, natural, fresh, whole foods, to include in your eating plan. Again, the key to eating to beat inflammation is the same as eating to treat diabetes. The principles are the same, which is why our nutrition guidelines are so effective for not only lowering blood sugar and A1C, but reducing inflammation, boosting overall metabolism, supporting sustainable weight loss, improving liver function, cholesterol, and blood pressure, and reducing medication. And really, the list goes on. The benefits to you are huge. It's quite amazing and fantastic, really, that when we choose nutrient-rich foods, our body takes the reins and knows what to do. You can get started today. Head to type2diabetestalk.com/food list and grab a free copy of our recommended food list. It's got a list of key foods to eat, minimize, or avoid. And if you follow along with the guidelines that's in there, you will be seeing some changes to your health, including decreased inflammation as well. And if you do happen to have an inflammatory condition like arthritis, that is certainly going to help with your inflammation on that front too. And as I said, if you're one of our members, head to the members site to find the anti-inflammatory index of foods alongside episode 41 or in the downloadable guides. That's all from me today. Thanks for joining me and take care until next week. Dr. Jetta, over and out.
Thanks for tuning in to Type 2 Diabetes Talk. Please subscribe to the show on your favorite podcast platform. And for episode replays, episode notes, and more, visit type2diabetestalk.com. New episodes are available Tuesdays, 10 a.m. US Eastern Time, or your time zone equivalent. Thanks again. We're truly grateful to be a part of your life and help make a real difference.